Welcome back. Oh man, you know that this show is about passion. It's about people doing things from their heart, doing things for others. Well, one of those things has to do with therapy and something called art therapy. What is art therapy? You're going to find out today. My name is Vin Dacquino. Our guest, Alix Sugarman. Alix, talk to me. What is an art therapist? What is it you do?
I love that question because people often have misconceptions about art therapy. They're not really sure how is art used to help.
Yeah, I thought it
people.
was painting.
Yeah. Or they say, oh, do you finger paint and talk about your feelings? And there's a little bit of that, but what art therapy really is mental health treatment with an experiential component.
So you help people who need help.
That's exactly right. So that can look a variety of different ways. It can really be with any kind of challenge in any kind of age group. We start to develop the capacity to create artwork and develop fine motor skills around the age of 4. So I usually start to see clients age 4, but my oldest client has been in their 70s or 80s.
Wow. So it doesn't make a difference.
Yeah.
Mental health is mental health.
Exactly.
So you bring people in, you help them reach whatever inside of them. I can relate to that. I've been working with writers for years. I work with veterans right now who have stories to tell. Some of those are painful, and some of those need to get out. And I don't know if it's a good term, but I call it taking out the trash. Things that stay too long aren't always healthy. And we bury them, and doesn't make the smell go away. You have to get the trash out, not just covered. So you have various ways of doing that. Talk to me about that.
Yeah, you just actually started off, that was a perfect segue to explain art therapy because you started off with a metaphor, right? And what happens to each of us is that we actually communicate in metaphor all the time. Mm-hmm. And we don't usually have a totally developed awareness of this, but it's a way that kind of our unconscious process comes through and comes out every day. So when you explain that, you're to you unearthing things that trouble you relates to garbage and a smell of garbage. That's really a great starting point for today because that's a very visual metaphor you just created, right? And so that's a very different experience of me understanding how you might relate to hardship than if you just said, things are crummy and I want to get rid of them.
Yeah.
No, you said it's like garbage. It's like reeking garbage. Yeah. And that's that really relates to how we can think about trauma, which is that it is a nonverbal process, right? When something terrible happens to us, it happens to our senses, actually. Your sense of smell is really actually one of the main senses that is usually very impacted by trauma, because if we see something visually and we're struggling with it, our brain is actually working pretty hard to encode it and understand, okay, I feel threatened right now. I never want this to happen again. I'm going to look what's in front of me. I'm going to smell what's in front of me. I'm going to hear what's around me. And when we go through hardship, we really sometimes have trouble letting go of those sensory experiences.
And it's a matter of actually being there, facing your day, facing your feelings, facing who you are.
Totally. And so we can use art as a process to do that. And just like we kind of described, a traumatic event happening to us visually, happening to our auditory system, our olfactory system, our sense of smell, art really involves all of those processes as well.
So define art.
So art is just really any kind of a visual explanation.
Sort of a creative outlet?
Exactly. So it might involve paint, like you spoke about. In my studio, I have really a variety of materials that I like to offer to clients. And throughout a session, we might discuss different opportunities to use them to reveal some struggles and some ways to kind of cope with those struggles. So that might mean colored pencils, oil pastels, different kinds of paint, paper. I like linoleum and carving linoleum. Sometimes it's a 3D process that we just need to access in order to resolve something. Clay. I like to offer something called an expressive therapies continuum. So I work with from materials that are on a spectrum from highly fluid to highly controlled. And as I know that you now understand very well, Vinny, that's really a metaphor, right? So everything I do in a therapeutic process is based around a metaphor of interaction. And I allow clients to come in to have a real sense of control and to understand how they might want to address something that's troubling them.
And now, sometimes that does bring troubling feelings.
Absolutely.
Because you're digging around in places that are supposed to be secure, but they're not secure. That's the whole key, is to help people understand that just because you buried it, you didn't put it in a secure place. You simply put it in a place. And it doesn't necessarily need to stay there. It probably necessarily needs to get out of there.
Yeah. Yeah, but I love that you brought up safety in that, you know, and that means coming from a trauma-informed perspective, understanding when people go through hardship, how they process that and how that kind of remains in their bodies, remains in their minds, and how it might kind of impact them on a day-to-day basis. And I think sometimes people are very passionate about creative arts, or they're passionate about helping people, and what they want to do is they want to get right to that. But I take sort of trauma-informed care very seriously, and I think coming at it from a very informed perspective and an educated perspective is how we're going to help people keeping their emotional safety in mind.
I used to do a thing called the Peanut Butter and Jelly Writing Academy with kids, and we used to actually eat peanut butter and jelly and cookies before peanut butter was outlawed, because kids were allergic to it.
Yeah.
But I was working with a young kid who was doing poetry, and I just explained to them that there's a thing called poetherapy, and it's using poetry to get into your feelings. And this young boy was writing the poems after we talked about that for a while, and he started crying. And I said, "You okay?" He said, "I think I dug a little too deep."
Yeah, absolutely.
And I said, "Yes," because that's the idea, to dig. And writing is a wonderful therapy.
Absolutely.
You know, if you talk about art, the art of writing, and I have writers all the time who are writing their memoirs, and sometimes they scare themselves, you know. And one of my writers just did a book called "The Boy Who Cried Suicide," and it was his problems with OCD. So when you work with your patients, it isn't any one particular problem.
It is not, you know, it is, I mean, I like to kind of fit it into an umbrella of trauma. And when I say trauma, that can mean, you know, a variety
Anything that traumatizes you.
Right, so that could mean a paper cut, or it can mean an IED in Iraq, right?
Or a divorce, or
Exactly. It could be longer, it could be a shorter term event, but the piece that, you know, I'm hearing you kind of explain is that when we work with a process that's an experience, so whether it's writing poetry, creating art, I use horses in treatment, so interacting with a horse, these things really access what we're enduring from a very deep place. And what we want to do is make sure that we have an awareness of how valuable that tool is, and a lot of education about how to support people in that process.
Just so that you are aware that I'm listening to you, did you say interacting with a horse?
I did indeed.
What are you talking about, Alix?
Okay, let me tell you about that. I work with something called the EGALA model. It is the Equine Assisted Growth and Learning Association. Their website is actually egala.org. And what they do is they use horses in an interactive setting. It's completely on the ground. I work with a team member who's an equine specialist, and we basically have what's been compared to as almost like a ropes course. It's an interactive process where we allow metaphor to come through, and we allow an experience to come through, and then we help people kind of process and understand how that experience relates to.
So when we talk about metaphors, we're talking about making analogies, and we're talking about trying to relate to something and to understand it from a different viewpoint. So when a patient works with animals. We're trying to get them to feel comfortable with that animal, to feel the love. Animals can give amazing love.
Actually, I really want to critique your language there because we're really hoping not to try to get them to do anything. And that's what I love about
They
Egala.
find that themselves.
Right, and we need to facilitate an experience that allows them to lead with their experience. So it's really about framing and facilitating that experience and then really being aware of what we bring into the picture in order to be sure that it's always led by that client.
Keyword, facilitate.
Right, so in the example that you actually gave, someone may need that love and someone may need to feel loved by, an equine, but that may be very different from the goals of someone who comes in and really struggles with relationships. They might need to go into that arena and just a challenging relationship may play out, and that might be the thing that they needed to discuss or uncover for that day. So, ideally, we want to be aware of having a positive or a negative experience, but really we're facilitating an experience and allowing them to.
And horses are not the only animals you use.
This is true.
Are you getting ready, guys? Because we have a surprise guest. Alix, let's meet the one and only Rita.
She just woke up from a nap.
Hey, Rita.
Come here, baby. Hi.
Oh, let's not mess up the mics here. This is Rita, and Rita is a service dog. Alix, what does service dog mean?
That's a great question, and it's something that's kind of widely debated because there isn't a lot of legislation out there. When I say service dog, what I really like to explain is that she's providing a service to me and that she supports my clients and is a working dog in my private practice. So for us, that means that she will greet new clients. She will, if they're in emotional distress, she'll be there as a source of support. She is a registered emotional support animal, which, to be totally honest, is just almost an irrelevant concept. It's you can register any animal online if they are providing emotional support to you. But with her, she has done a lot of work just kind of greeting my clients, being available to my clients, and my hope is that she just continues to be another resource and another.
Now, training a dog like Rita, what sort of things would you have to do to train Rita to be affectionate in that way or to understanding?
Mm-hmm. That brings us back right to metaphor and just kind of not leading an experience. So sometimes, like right now, maybe I need some kisses, I need some affection, but some days, she's just present. And so her presence is part of the story that I'm hearing and learning from a client. So maybe that means affection sometimes, and sometimes it's really just her being there. So we're working on just having her, she's only about 13 months old, she's pretty young, just having her, greet clients appropriately, really stay in one place so that she's not invading boundaries.
She's been so wonderful this whole time.
She's great.
I haven't
she's
heard a peep out of her.
A television debut, right?
Yeah, you're a star. That's how Lassie got started. No, maybe not. Yeah. So do you recommend that patients get a pet?
I do a lot of work with post-traumatic stress and veterans. I work in a retreat setting for a foundation that does fully funded retreats for veterans, couples, families, and military sexual trauma survivors. So that's called the Lone Survivor Foundation.
Wow.
And I meet a lot of veterans who have animals. Again, it's sometimes it's a recommendation, and sometimes I just have really an opportunity to meet an animal who's already involved in a client's life. So it just sort of depends on the there
so
she is.
cute.
She's looking
Hey,
great.
you're pretty photographic there, kid.
She is. Looking good.
So, what's out there?
She says, "Is that me?"
Yeah, she said, wait, I know that person in that.
And that's great.
Look at that. She's funny. Do you actually have the animals present at the therapy session?
So with the model that I spoke about before, sometimes we will be in an arena with horses. So I work in private practice right now, but I will connect with different facilities to be able to facilitate the gala model that I spoke about. And other than that, I, again, will have her in an office setting. Because I just believe in really being able to provide kind of a myriad of different tools. So if interacting with a dog is something that would be helpful to a client, I want to make sure that they have access to that. But that it's also a choice. So usually we'll always ask a client before they come in, are you comfortable with the dog? Is that okay with you? Is that a preference for you? And sometimes, they're fine with dogs. They like them and they maybe have a dog of their own, but it's not something they're interested in having in session. So I like to
Rita, is Rita in the office with you?
Exactly.
Wow,
exactly.
so Rita's right there.
She's right there, and she'll be there through the art process. And
wow.
And sometimes, she will respond by providing emotional support. So if a client feels overwhelmed, she might go over and just be near them.
So therapy isn't like taking a course. You don't say, okay, well, this is going to be 13 weeks and 2 days. It takes time, and it takes patience, and it takes willingness. Mm-hmm. And a client has to understand that this is a way to get healthier.
Mm-hmm. Mm-hmm. That's a really good way of putting it. And we have, in every client that I encounter, whether it's in private practice or in a contracted experience, we have what's called a treatment plan. So there are objectives for how that client would like to see that increase in their health. And so sometimes we evaluate that on a quarterly basis. But really, it's just about in the moment, every day, being able to respond to that client's needs.
Now, is this a situation where the client first has to understand that there is a problem?
Always, always. Or, you're kind of left with a tricky situation in therapy, which is you can provide a lot of support and a lot of clarity on patterns of behavior or patterns in relationship. But, I say to my clients that it's really about their process and their choice, and that's really paramount in a therapeutic
So you need
process.
to bring the problem to the surface before you can work with it.
Yeah. Absolutely.
Makes sense.
Mm-hmm.
Makes sense. How long is a session?
I see clients for an hour. I like to just make sure that I can provide at least 60 minutes, and sometimes the best work happens in the last 15 or 20 minutes. Some clients see individuals for 45 minutes. If it's a group, I sometimes, will have an hour-long group and just allow clients to engage in art making and engage in a verbal process and figure out kind of what they want to work with.
Is group therapy usually part of therapy, or is that a separate thing? Is that a stage of therapy?
No, it's just it is a separate thing. It's a resource available to people. So like right now in private practice, it's tricky for me to get a group of people together who want to engage in the art process.
Yeah, do they need to be in same situations? Like, can I have a veteran who is suffering from post-traumatic syndrome in with someone who's suffering from a divorce or a sexual encounter or...
just like you said, you want to be very aware of what each person's presenting with and how that presentation might relate to a process. So if it was a group that I recommended to someone, I would want to make sure that aligned with their goals.
Yeah, I know that when I work with writers at the Hopak Library, mm-hmm. We have a varied group. We have very young. Mm-hmm. I have a kid in high school, and I had an 86-year-old woman. I also have people who've been published several times and people who've never published a word. Mm-hmm. And I caution them to be careful on how they comment, because some things could be hurtful, and you have to just be careful. Now, I imagine that's something that you are very cautious and careful about.
Absolutely, and I love hearing that that's something that you really introduced, because when we're talking again about an experience, so a group is really an experience as well. It's if it's a therapeutic group, it's an experiential model, in that you're really not only talking about what you're sort of presenting challenges, but you're going through a process of acclimating to that group, and that's a reason why group process is so powerful.
And there's some people, I imagine, who are there because they can't socially interact, that they're having difficulty socially interacting.
Right.
And now they're in this group and they're uncovering some of their quote unquote trash or garbage, and they're doing it in front of others.
Right.
Heavy stuff.
Right.
So there are stages,
Right.
and you help your clients work through those stages. You don't just kind of like rush in there and
Absolutely.
say, all right, you're having trouble, here's your problem. And it's a process.
Right, right. That's exactly right. And so, when we're thinking about, things that just weigh heavily on us, we really want to be aware of having safe relationships and safe environments to explore those. And that's where therapy can just serve a really great role. We all have skeletons in our closet, so to speak. We all have challenges, and if we're willing to be vulnerable, we're willing to confront those challenges. And I feel very, very honored and very lucky to be a part of that process for someone every day.
Yeah.
Because
you're helping them to be all they can be, and
Right.
that's so important. It's just there are people who are walking around carrying this weight, and every day is a gift, and it's a waste of that gift if we wake up regretting to be awake, fearing to be awake, worrying about yesterday, and preventing ourselves from having a good tomorrow. So you help to take some of the burden of yesterday away, and let them understand that there is a light at the end of that tunnel. Most of the talking is done by the client.
Yeah, absolutely.
Yeah, because I think one of the things you hinted at is that your job isn't to give them relief from their situation. It's to help lead them there. The word I love that you use is facilitator. You're facilitating. You're not giving them what they need. You're helping them find what they need.
Absolutely, absolutely. And those solutions, are inside of them. And so I think if I can provide an experience or a process that might allow them to access that, then I've done my job. But Vinny, there are a lot of really bad therapists out there. Because people can be very well intentioned, but accidentally sort of allow their own process and their own needs to come into the process. So if you are committed to your practice, it's a lifelong process of examining, where you are and how that might relate to a client.
Yeah, and I think that is key. That one of the things you said is about a safe environment. Some of these problematic feelings inside a person are like dynamite. And you can't just go in there and grab it. Right. You have to cut the wires, and you have to be very careful about how you treat these. And if you're going in there and you're disturbing all this, you better know what the hell you're doing. Right. Because you can do more harm than good.
Absolutely.
And you can't just go in there and pose all these questions without the possibility of an answer.
Right, right.
And I like what you said when you said, not only is the problem in the client, but so is the solution. They're in there together. And you have to marry those two, and you're going to have to get those and help them lift that out. And it's not just simply a matter of, cutting a person open, reaching in, finding the problem, yanking it out, sew them back up, and say, go home.
Right, right.
It's a process. And that's what you are, a professional, and what you're doing to do that.
And I like, I don't know if you have any questions about this, but I really like to advocate for how to be emotionally supportive to others. And so I think what we're missing with that within a lot of relationship today is that we underestimate the power of holding space for someone, of just witnessing and listening without interruption.
Wow, that is so key. I was director of teacher training for several years. And one of the things I tried to say to teachers is that often it's not how a child acts that's a problem. It's how a child interacts and how a teacher interacts with a child. Often, what we see a child do is not an action, it's an interaction. It's a reaction from something you've done. And you have to understand, too, that when you're working with someone, what you do is a part of what they are trying to come together with. So how you treat someone, how you react, what you say, when a teacher says, "What are you doing in this room?" immediately the child feels like he thinks I did something wrong. And that reaction that the child is doing has to do with what you've done too. So teaching people how to work with others, how to be socially adaptable is probably a big part of your job too.
Absolutely. And I mean, I just can't stress enough just how important it is to listen to each other, to witness each other without interruption. Because when we want to relate to someone else, often we want to share our own experience. And I think it's just often, interrupting someone who maybe just needs to be seen and heard. I have an example, actually, a friend who had a friend recently who was diagnosed with cancer, and she called me and she just said, I can't talk to anyone about this. As soon as it comes out of my mouth, cancer, they don't want to hear me. They just want to interrupt with their own story. And so,
So Alix, here's the question.
Yeah.
In our next and last 60 seconds, what are you saying to these people? Should they consult a therapist?
Yes, I think therapy doesn't just have to be a verbal relationship. It can be an experience, and therapy is just a powerful tool and a resource out there.
Your website, I think, is on there, has been on there. Alix Sugarman, keep doing what you're doing.
Thank you.
Reach
Thank you
in,
for having me.
help people. That's what this show is about. It's about passion. It's about caring. It's about community. If you need help, go get it. It's nothing to be ashamed of. We all carry weight. Carry it, share it, be a better you. Alix, thank you for being here.